Donning personal protective equipment sequence for low possibility Ebola virus disease using a reinforced gown. The dressing of PPE sequence should be supervised by another trained member of the team known as the buddy and the relevant documentation completed. Hand hygiene. Either alcohol-based hand rub or soap and running water can be used for hand hygiene. Always perform hand hygiene with soap and running water when hands are visibly soiled. Don scrub suit in changing area. Ensure pockets of scrubs are empty. Ensure closed, puncture and fluid resistant footwear is worn. Secure her back of face and neck. Don theatre overshoes or boots. Secure all ties with a simple bow. Perform hand hygiene. Don respirator protection FFP3. Position one strap at neckline and second strap at crown. Fit check mask. Breathing deeply in and out, checking for leakage. Put on head cover. Apply hat so that forehead and ears are covered. Ensure all hair is covered. Put on visor with or without goggles. Adjust to fit. Ensure visor and head cover overlap over brow. A visor can help reduce exposure to the eyes and provide protection to other facial areas. Goggles help protect a wearer's eyes from splashes, sprays, droplets, and can be worn in addition to visor. Perform hand hygiene. Put on first pair of extended cuff gloves, known as the under cuff gloves, that fit snugly around the wrist, are essential for use with a gown. Put on reinforced gown. Fully cover torso from neck to knees, arms to end of wrist and wrap around back. Fasten at back of neck and waist with a simple bow tie. Put on second pair of longer cuff gloves, known as the overcuff. Gloves extend over gown, suit, cuff. At this stage, final check of PPE should be completed by buddy and any breaches corrected. Complete log room sheet and PPE sequence sheet. Inform colleague that while wearing PPE, avoid touching or adjusting PPE. Remove overcuff gloves if they become contaminated. Apply further set of sterile gloves in the room. Doffing personal protective equipment sequence for low possibility Ebola virus disease using a reinforced gown. The removal of PPE sequence should be supervised by another trained member of the team known as the buddy and documentation completed. When changing overcuff gloves, grasp the outside of overcuff glove near cuff with opposite gloved thumb and forefinger. Peel off, turning it inside out. Hold removed glove in still double gloved hand. Slide finger of single gloved hand between interior of double glove and gown. Peel off, turning it inside out. Discard glove bundle. Exit isolation room to doffing area. Buddy will supervise and give direction on sequence. Buddy does not touch colleague and prepares to record documentation sheet. Reinforced gown front, sleeves and the outside of undercuff gloves are contaminated. Remove gown gloves carefully. Unfasten tie fully at side. Pull gown away from neck and shoulder. Touch outside of gown only with gloved hands. Cross arms and pulling gown down from shoulders over elbows. Fold or roll inside out into bundle. As you are removing gown, peel off gloves. Only touch inside of gown and gloves. Perform hand hygiene and don a new pair of gloves. Remember, outside of visor or goggles are contaminated. Remove the visor with or without goggles. Do not touch the front of the goggles or visor. Hold by headband of visor or arms of goggles. Lift away and outwards from face. Remove head cover. Do not touch forehead. Remove outer shoes. Grasp at material. If boots are worn, please refer to doffing Tyvek coverall sequence. Remove gloves. Grasp outside of glove near cuff with opposite gloved thumb and forefinger. Peel off, turning it inside out. Hold removed glove in still gloved hand. Slide fingers of exposed hand between wrist and interior of glove. Peel off, turning it inside out. Discard glove bundle. Perform hand hygiene. Remember, outside of FFP3 mask is contaminated. Do not touch face or front of mask. Remove FFP3 mask. Grasp bottom ties, elastics of the FFP3 masks and remove overhead first without touching the front of mask. Then grasp the ties or elastics at the top and remove overhead without touching the front of mask, holding by straps. Discard. perform hand hygiene. Body completes documentation, log room sheet and PPE sequence sheet. Body notes any breaches and reports immediately to ward manager. Perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE.